So, in this video, I'm going to discuss about examination of lymph nodes. Examination of lymph nodes plays a very crucial role in making diagnosis in general medicine as well as in general surgery. In general surgery, especially in case of carcinoma of the breast, examination of the axillary lymph nodes plays a very crucial role in making the proper staging of the tumor. So, have you ever palpated your lymph nodes? Yes, we too have different groups of lymph nodes in our body. The cervical one, the epitrochlear one, inguinal ones, but these are not normally palpable because the size is less than 0.5 centimeter. When the size of the lymph nodes increase more than 0.5 centimeter, when the consistency alters, when it becomes tender, when it is associated with any underlying malignancy, what will happen? The lymph nodes become palpable. These lymph nodes are attached to the subcutaneous tissue. Sometimes in malignancy, this will be very deeply attached with the skin or the underlying muscles, and hence it becomes hard in consistency. So these changes makes the lymph node palpable. So what are the various things you have to keep in mind while doing an examination of the lymph nodes? Sight, size, skin over the lymph node, then the surrounding region, consistency and tenderness. As I have already told you, the size normally less than 0.5 centimeter. The lymph node can be palpable when the size becomes 1 to 2 centimeter. When the lymph node's attachment, to the underlying muscle or the skin is so firm, we suggest that it is because of underlying malignancy. Coming to consistency, in Hodgkin's lymphoma, the lymph nodes have a characteristic rubbery consistency. In tuberculous lymphadenitis, the lymph nodes undergo clumping, that is called as mated lymph nodes. Or in malignancy, the lymph nodes will be so hard. In acute viral or bacterial infections, tonsillitis, infectious mononucleosis, tenderness will be seen on palpation. So these are the various parameters you have to keep in mind while you are palpating the lymph nodes. What are the different group of lymph nodes that we usually palpate? The cervical one, epitrochlear group of lymph nodes, and the inguinal lymph nodes. A separate video will be posted regarding the examination of axillary lymph nodes. So remember, always the lymph nodes has to be examined by asking the patient to maintain the sitting posture. In sitting position, standing behind the patient, the lymph nodes has to be examined, and the palpation has to be done with the most sensitive part of our hands, which is the tip, the fingertips. Fine. So with this, let us go for the first group of lymph nodes, that is so called as the cervical group of lymph nodes. In the cervical group of lymph nodes, first, as shown in the picture, stand behind the patient and we are going to palpate the lymph nodes in the anterior triangle. We are going to palpate the lymph nodes in the anterior triangle, standing behind the patient. And remember, the lymph nodes has to be always palpated or examined bilaterally. That means one side lymph nodes consistency, number, size, everything has to be compared always to the opposite side. So this is the correct way in which we have to palpate the anterior triangle lymph nodes. That is between the two heads of the sternocleidomastoid. The second picture as shown here, this shows how you have to palpate the scalene lymph nodes. That is, we have the sternal head and the clavicular head of the sternocleidomastoid, and we have the clavicle, and in the angle between the sternal head of the sternocleidomastoid and the clavicle, we have an angle. This angle is the place where we have to palpate using our fingertips. We have to palpate the so-called scalene lymph nodes. How to palpate the posterior triangle lymph nodes? You come and stand in front of the patient using your fingertips. You palpate behind the clavicular head of the sternocleidomastoid, which is actually, behind the clavicular head of the sternocleidomastoid, we have the posterior triangle. So these are the three areas in which we have to palpate the cervical lymph nodes. Of course, there are a lot of other areas as shown in the pictures. We have the preauricular, which is in front of the tragus, postauricular in the mastoid, submental, submandibular, but which is not of that much importance. And we have the supraclavicular lymph nodes. Okay, lot of GI malignancies are diagnosed by palpating the lymph nodes in the supraclavicular region. We have to palpate by standing in front of the patient. We have to palpate by dipping our fingertips in the supraclavicular group, and similarly the infraclavicular group. Okay, so remember, when it comes to anterior triangular scaly lymph nodes, stand behind the patient. Posterior triangular supraclavicular and infraclavicular regions stand in front of the patient. Coming to the epitrochlear group of lymph nodes, as shown in the picture, you have to ask the patient to have a partially flexed elbow. Okay, and we have to with our one hand, we have to support the wrist, and with the other hand, we have to palpate behind the medial epicondyle. Medial epicondyle, we have behind the medial epicondyle, we have a groove, and there we have to palpate the so-called as the epitrochlear lymph nodes in partially flexed position with the wrist supported with our one hand. Coming to the inguinal group of lymph node, we have the anterior superior iliac spine to the pubic tubercle, which is nothing else but the extension of the inguinal ligament. Just below the inguinal ligament, we have to palpate for the horizontal group of inguinal lymph nodes, and just see the pubic tubercle. First palpate the pubic tubercle, and 3 to 4 centimeter below and lateral to the pubic tubercle, we have to start palpating downwards for the vertical group of lymph nodes, because we have both group of lymph nodes. One is the horizontal and the vertical group of lymph nodes. So the key takeaways are: examine the patient in sitting position, stand behind the patient, palpate with the fingertips, anterior scalene behind the patient, infraclavicular, supraclavicular and posterior triangle in front of the patient, epitrochlear lymph nodes, partially flexed elbow with hand supported on one side, and in inguinal, very important, I forgot to mention, ask the patient to lie supine, okay, flat, expose the inguinal region, palpate for both groups, horizontal and vertical group. Fine. So hope this video is helpful for you. Remember the various parameters: side size, consistency, tenderness, skin over the lymph nodes, and the surrounding region. Okay, thank you.